market?
I think there's some other pieces to the puzzle that are within the neuromodulation space. Peripheral nerve stimulation is another piece that we think is growing as well. Bioelectronic medicine, which I had mentioned before, we're starting to see a lot of investment there. Uh, and that really has some great potential, right? How do we, bioelectronic medicine, the way that we're defining it is it's a piece of the modulation market. However, it modulates a human organ. So it modulates your digestive system, right, for obesity, or it modulates what we're doing in terms of your intestines or your kidneys, if you will. So it's modulating that human organ, even the heart, right? So we can potentially get to a space where we're modulating our human organs instead of taking pharmaceuticals to help solve those problems. One of the hurdles that we have to get over in this industry is what we call the last resort syndrome, right? This was coined off of cochlear implants, which are actually a piece of the neuroprosthetic market. But and whether you like them or not, Rush Limbaugh got on his radio show and he said, "Well, I'm going to go get a cochlear implant. It's my last resort." And that's where these devices have been sitting. Medical devices have been the last resort. Oh, I'll try all of these other things and then I'll get a device because that's my final piece. But we need to move up that ladder in the decision point. And we've seen some studies that help with that. So for instance, deep brain stimulation, right, for Parkinson's disease. A lot of times if you talk to people in the Parkinson's disease community, they're going to take all of the pharmaceuticals that they can to control their tremors. If they can't control that anymore, then they're going to go for a deep brain stimulator, right? It's the last resort device. But the early STIM study was a significant study that said, hey, listen, if we implant this device early in on your diagnosis of Parkinson's disease, we can actually slow the progression of the disease. An aha moment. This device really shouldn't be a last resort. It should be something that people consider early on, and that physicians are actually discussing it with their patients of, here is one of your choices. What are the choices that you want to make?
Wow, that's really cool. So you think this is the Parkinson's is the thing that's putting it, ahead, not as a last resort. So that's kind of pushing it more towards early.
I think that was a significant study. I also think that there's a societal piece of this as well. We are becoming much more comfortable with having technology or using technologies with our bodies, right? How many people do we know with pacemakers, right? Pacemakers are incredibly common. So implanting medical devices we're becoming much more comfortable with, and we're also becoming much more comfortable with the fact that we can use devices on our bodies to help improve ourselves. So I think that's a real significant piece in terms of what we as society are willing to accept.
It's kind of a chicken and the egg. Like it won't be accepted until a lot of people do it, but a lot of people won't do it until it's accepted.
Right. But I mean, when we look at the neuroprosthetic market, right? So neuroprosthetics, the way that we define them is that it's a technology that either restores function of a limb or a lost limb, replacing for a lost limb. I wouldn't say an organ, I would say a function, right? So that's why in this space in neuroprosthetics, this is why we put cochlear implants in this space, we put visual prosthesis in this space. Even though it's sensory, it's not a limb, but it's really a function that we have in our sensory systems. And right now we're projecting that visual prosthesis is going to be exponentially growing at about a 70% rate over the next 4 years. It's an incredible growth space. When you think about our aging population and how they're losing their vision, if we can restore that so that people can keep their vision or have some form of vision, we're really kind of filling an unmet need. And we're starting to see more companies come out into this space.
Wow. What's allowing that actually? Like that hasn't been around for so long, right?
It hasn't, but we've seen the advancements of technology. That's a key piece, right? Of how do we build the devices so that we can restore vision. how many channels can we put into a chip, right? We've restored black and white, shades of gray movement, right? But now we have chips that can have more channels, so now we can pull in color, right? And we can start to restore color for vision. That's a key issue for people to be able to use these types of devices. There's a company called Second Sight that brought their device onto the market very quickly. They showed an unmet need. They are actually getting reimbursement for it as well in the U.S. and in other parts of the world. They're restoring vision for people that have lost it. So that's a really important piece. Another important growth area that we see in neuroprosthetics is robotic exoskeletons, right? We see these big clunky things today that we wear. That was actually grown, the first concepts came out of a DARPA project back in the 60s, right, to help with our military. Now we're seeing them used to help people with paralysis, whether it's from a stroke or from a spinal cord injury or from a brain injury. But we believe that the technology is moving forward enough and that we're able to get these devices onto the market that we're seeing a growth segment in this piece. But also the technology, as we drop it down, right? We turn from these clunky robotics into something that we can wear much more elegantly, that we can use out in the marketplace. Then we see that that's going to be a growth area where more companies are going to come in. In parallel with that, another segment of neurotechnology is neurorehabilitation. It's a very tiny piece of the market, but we also see robotics as a growth area for rehabilitation. Why? Because people having stroke, right? People having movement disorders, people having paralysis. How are we able to use these robotic devices to be able to restore function much more efficiently than we've been able to do before with just volitional control or with just contemporary physical therapy? So we see that as a growth area as well.
Wow, that's incredible. Yeah, so what's maybe like a personal favorite, or like what's exciting you the most, and what do you see having the most potential in all of these things and in generally the neurotech space?
I think there's a couple of things that really excite me personally. One is the less invasiveness of devices. That growth of the technology, I think, is really exciting. Because, I mean, think about it. The device that I have, it took 7.5 hours to implant it. My second, device took 7 hours. Deep brain stimulations, we're opening up people's skull and sticking stimulators in them, right? When we think about that, that's invasive, right? So people are getting it, because they're seeing a true benefit. And really, so we can help understand the benefit versus risk. It's going to be different, whether you're somebody that's living with a degenerative condition or a lifelong chronic condition compared to somebody that's just trying to enhance their performance in their golf game, right? Their benefit to risk is going to be very different. So we need to help understand that. So the less invasiveness of devices, I think, is getting to be really exciting, and what that means is that also for implanted devices, so that we can come up with very simple surgical ways of implanting things into our body and being able to get the same function that we do today. So I think that's a big growth area, and it's really, really exciting. The other piece of the puzzle kind of marries the neurosensing neurodiagnostics piece of the market with neuromodulation. And why do I say that? Is because I think a big piece of the puzzle that we can solve is with mental health and psychiatric conditions. The way that we diagnose psychiatric conditions, when you think about it, is really it's loose. It's not very scientific, right? I have you go into my office and I have you complete a questionnaire, right? And that's a snapshot in time, right? So I could be having a good day, I could be having a bad day when it comes to mental health. You're not seeing how do I go through this pattern to be able to make sure that I'm properly diagnosing a mental illness.
It's quantitative, or it's qualitative, not quantitative.
Not
right?
quantitative. So we're starting to see some of the neurodiagnostic pieces, some of the interfaces, the apps that we can use to help properly diagnose mental illness. and psychiatric conditions. That's one piece of the puzzle. But then how do we treat it as well? So that's where we go into neuromodulation, into this transcranial electrical stimulation, into these other types of brain implants. That's a really exciting piece where we can now properly diagnose and how do we properly treat that. So I think that's a really exciting growth area, because the brain is an organ that we really don't understand, right? We really truly, it's kind of the frontier of the human body that we're still trying to understand. But I think if we can get our arms around diagnosis and treatment of mental illnesses and psychiatric conditions, I think we can make a huge contribution to society.
I can't wait in 20 years when we look back and be like, we did that? Like, that was so crude. It's kind of like bloodletting or leeches or something like this. And then we'll be like, we really just asked people like if they were depressed, and versus like running a diagnostic on their chip or something like this. So it is pretty exciting stuff.
That's an exciting piece. Yeah. Yeah. And I think, for me personally with spinal cord injury, I've been excited about the neuroprosthesis space for a long time, but I'm also starting to see two things happen. One is the spinal cord injury community is becoming much more receptive to technology and the use of technology, whether it's in rehabilitation or whether it's with a prosthetic or modulation. And I'm also seeing the research in terms of how do we restore function to people volitionally. How do we match the brain with an implant? How do we tap into this spinal cord so that we can restore function is really exciting, right? More research needs to be done, but I think personally from a spinal cord injury perspective, I think it's a fantastic space to be in.